Acute flaccid myelitis, AFM, is a rare but serious condition that affects the nervous system, causing muscles and reflexes to become weak. Patients with AFM often start with common cold like symptoms, but this quickly escalates to sudden and severe muscle weakness, particularly in the arms or legs, and can be accompanied by loss of muscle tone and reflexes. Some individuals may also experience difficulty moving their eyes or drooping facial muscles, trouble swallowing, or slurred speech. Currently, there is no specific treatment for AFM, but interventions may include physical therapy to regain muscle strength and, in severe cases, ventilatory support if breathing is affected. Risk factors are not fully understood, but AFM tends to occur more often in children and can be preceded by a viral infection. To gain a more comprehensive understanding, let's explore detailed aspects of the disease. Symptoms and progression of acute flaccid myelitis, AFM. Acute flaccid myelitis, AF, manifests as a sudden onset of limb weakness, often accompanied by distinctive facial drooping, difficulty moving the eyes, and slurred speech, resembling symptoms of polio. The condition particularly affects the spinal cord's gray matter, leading to muscle and reflex decline. While its progression can vary, most patients reach the peak of their symptoms within hours to days, which can escalate to respiratory failure if muscles involved in breathing become immobilized. Recovery is unpredictable. Some patients may experience rapid improvement, while others face long-term disability. AFM is often linked to viral infections, causing an immune response that damages the nervous system, highlighting the critical importance of recognizing and addressing early signs to optimize outcomes. Diagnosis of acute flaccid myelitis, AFM. Diagnosing acute flaccid myelitis, AFM, a rare but serious condition that affects the nervous system and causes muscle weakness, resembles a high-stakes detective endeavor, blending clinical acumen with advanced medical technology. With symptoms mimicking those of polio, including sudden onset of limb weakness and loss of muscle tone, physicians must rapidly distinguish AFM from other neurological disorders. Critical to this process are magnetic resonance imaging (MRI) scans, which can reveal the telltale lesions on the spinal cord, and cerebrospinal fluid (CSF) analysis, which can rule out other causes like infections. Timeliness is key. An accurate diagnosis allows for immediate supportive care and rehabilitation strategies, providing the best chance for recovery in a condition that currently lacks a targeted treatment. Cause and risk factor of acute flaccid myelitis, AFM. Acute flaccid myelitis, AFM, is a rare but serious neurological condition that resembles polio in its effects, notably causing weakness in the arms or legs and, in severe cases, paralysis. The exact cause of AFM remains elusive. However, a strong association has been observed with viral infections. Enteroviruses, particularly enterovirus D68, EVD68, have been frequently identified in temporal proximity to AFM outbreaks, suggesting a causal link. These viruses usually cause respiratory illnesses, but in some individuals can trigger an immune response that leads to inflammation and damage within the spinal cord. Factors that may increase the risk of developing AFM include being a child under the age of 18, a demographic that has shown to be most affected, and having a history of recent respiratory illness or fever. Environmental and genetic predispositions are also being explored as potential risk contributors, further emphasizing the complexity and multifactorial nature of the disease. Treatment and management of acute flaccid myelitis, AFM. The treatment and management of acrylic flaccid myelitis, AFM, a rare but serious condition that affects the nervous system, causing muscle weakness and paralysis, demands a swift and comprehensive approach. While there's no specific cure, interventions focus on alleviating symptoms and preventing complications. This includes physical therapy to regain muscle strength and occupational therapy to address daily living activities. In severe cases, respiratory support might be necessary. Management often requires a multidisciplinary team comprising neurologists, physiatrists, and infectious disease experts. Early diagnosis and interventions are crucial to optimize outcomes, and research into antiviral therapies and immunoglobulins is ongoing to enhance treatment protocols and diminish long-term impacts.